Welcome to American University's 2022 Alumni Workshop Series, sponsored by the Measurement and Evaluation Program. Today's session is on assessing data quality, tips and tricks during COVID-19 with 2019 Measurement and Evaluation Master's alum, Ashley Bishop. At American University, we are committed to pursuing inclusive excellence. One of our practices shared from our Indigenous and Native communities is to offer a land acknowledgement at the beginning of our meeting and events. The goal is to build our mindfulness of the historical processes in which we all still participate. American University is founded on the unceded land of the Nacotchtank, Anacostan, and Piscataway peoples. I ask you to join me in acknowledging these communities, their elders, both past and present, as well as future generations. American University also acknowledges that it was founded upon the exclusions and erasures of many Indigenous peoples, including those on whose land this institution is located. With this acknowledgement, we commit to working to dismantle the ongoing legacies of settler colonialism. Before we get started today, I would like to hear where you are joining us from. So if you would like, if you could perhaps write in the chat box where you're from, and I will read them out. We have people joining us from New York City, from Columbia, Maryland, New Jersey, Charlottesville. We have someone in Maine. I wonder if it's getting warmer yet in Maine. Somerville, Massachusetts, Hennepin County, Minnesota. We have people joining us from all over, and Washington, D.C. Yay. Awesome. Well, thank you very much for joining us today. Our speaker is Ashley Bishop. She is the MEL Technical Lead at Winrock International. She works in a program called Agile, Analytics, Gender, Inclusion, Learning, and Evaluation in that particular unit. In that role, she ensures that monitoring, evaluation, and learning practices on projects are professionally executed. She supports a variety of different USAID and Department of Labor portfolios in countries in Senegal, Ghana, Mali, Niger, Burkina Faso, Laos, and the Solomon Islands. I'm going to give it away to you, Ashley. If you have any questions as we start our conversation today, please put your hand up. We can go ahead and when we have a break in the conversation, Ashley is happy to address questions as they come up. Thank you very much for joining us, and I look forward to learning from you.
Great, thank you. Thank you, Dr. Peters, for that introduction. And hello, everybody. Thank you so much for joining us today. I'm really excited to hear from you and engage in this discussion with you. So, as Dr. Peters mentioned, I currently work as a technical lead for project support monitoring and evaluation. I finished the Master's of Evaluation Science program at American University in 2019. And prior to that, I had gained a Bachelor's of Arts in International Relations from Boston University. So I've been working in international development for 12 plus years now, and most of that time working in monitoring and evaluation, which is what we call measurement and evaluation in international development. I've worked for Save the Children, Plan International, Compassion International, and now I work for Winrock International. And I've worked in a lot of different technical areas, so monitoring and evaluation of many different types of programs around the world, and for a lot of different donors. Though primarily right now, I work on projects that are funded by the United States Agency for International Development, or USAID. So I'm going to talk to you a little bit today about my job, what it looks like for me providing M&E support before and during COVID. And within this context, how I have to execute my job specifically related to assessing the quality of data in our projects. I'm going to share with you some lessons that I've learned from having to conduct an internal data quality assessment And I would love to have a discussion and hear from you all as well about your experiences in this area of having to try to do this job with COVID-19 becoming a reality in our lives. I'll also be sharing with you some more information. Some of it was shared with the invitation to this webinar, but I've since found even more things that you might find interesting if you're interested in learning more. So as I mentioned, let me move this here so you can see the map a little bit better, but I sit here, so I didn't share with everybody where I am. I'm in Virginia over here, and this is kind of the worldview of what my job looks like. While I'm sitting here in Virginia, I'm supporting 7 projects in 7 different country locations, which in international development and the roles that we play is not very unusual. This is usually what it looks like when you're providing technical backstopping support to project-based monitoring and evaluation staff. Before COVID-19, the way I did this job looked a little bit like this. There would be a smaller version of me on this tiny airplane traveling all over the world, which was one of the things I really did love a lot about my work and my job. Sometimes, however, it became a lot because I was often expected to travel upwards of 25% of my time, which equals over 1 week a month for the whole year. It's a lot of travel. But it was expected because when you're doing monitoring and evaluation technical assistance, there's a lot that you have to go out and see physically happening. Part of what your job entails when you're trying to ensure that good practices are being followed is that you have to go and see how is the data collection actually happening? Where are the forms going? What are people actually doing? Are the connections really being made between what we've explained on paper and what it looks like in practice? So it was quite common for technical advisors like myself to be traveling quite frequently. Additionally, staff that I would be working with in these different locations would be traveling a lot more themselves. They may have been traveling internally in their own countries to visit different project sites, not necessarily in airplanes, perhaps by road. But then we were also really promoting the practice of having people who were based in countries that were very close to each other to be able to visit each other more often, and potentially having more regional working groups or ways that people could be reinforcing their skills together. So this is what things were starting to look like in the work that I was doing before COVID started. Now, I'd love to call this after COVID-19, but it's really during COVID-19 because we don't know an after COVID-19 just yet. But while we had been used to working from a distance with looking at computers as we're currently all doing right now, most of this work has really transitioned into remote work on many different levels. So the element of the airplane has definitely taken a back seat. And we're trying to transition a lot of the observations that we're trying to do, the capacity building and training. We're trying to translate a lot of that into this digital platform. And side note, a plug for the AU program, I learned how to do a lot of this already, having to do so much of our coursework online and using a lot of online platforms. So that has definitely been one way I can tie the program to having equipped me as I've been transitioning to this new change. However, in a lot of other places, people have not necessarily had this experience or have this comfort level. Additionally, COVID-19's impacts have been different throughout the world. So while right now where I sit in Virginia, things are starting to open back up. We are using masks less and less, and the caseload has gone way down. But my teammates over here in Solomon Islands have only experienced their very first outbreak in the last 2 months. And they're experiencing their very first rounds of lockdowns, which has a huge impact on their ability to do their regular day job. So it's still very much a during COVID-19 timeframe in the way that we work. So this has a lot of implications. As I mentioned, we have fewer home office or headquarters support trips from different technical staff, including M&E technical staff. In countries, staff who are based perhaps in capital offices may not be able to travel to their field offices as often as they used to. And even locally, even where activities on a project are often taking place, lockdowns may be regular or recurring, and there may be more movement restrictions than we had initially anticipated. All of this has a big impact on how we do monitoring and evaluation. So some of the things that I've observed that have changed and that have happened is that we're doing more surveys over the phone than I've ever seen before, where we are trying, when we're registering participants and beneficiary groups, to get their phone numbers and actually conduct surveys orally over the phone with them. When we are traveling to the field less, then what we found happens is we're trying to collect a lot more data at one given time than we had ever planned. So forms are becoming combined to being longer and longer and longer, and that can result in worse and worse data quality if we're not careful about it. There's obviously been a lot of limitations in group meetings, numbers of people who can meet in a group together in many different settings. So this has had an impact on our traditional use of focus group discussions and other qualitative methods. Definitely focus group discussions has been the hardest thing to try to adapt to a virtual setting. While interviews can be adapted more easily, direct interviews with individual respondents. And we just often have found that we relied a lot on having people in groups in order to administer other forms of data collection. Ways that we assumed people would be getting together and would be physically present are no longer things we can easily assume in order to get our data collected in the same time frame we used to. But ultimately, this may seem really obvious, but it's become so much more important to have our data digitized. We have to have it in digital form as early as possible so we can review it in real time, and we really can no longer afford to have any lag time with data entry. So while we know this in certain contexts and it's become very standardized, and in other places, it's still part of our growing pains in monitoring and evaluation is to transition teams to collecting data using digital methods. So one of the pieces of guidance I wanted to share with you, which came with the invitation that we sent out, is some guidance that Winrock International developed back in 2020, providing some top tips and guidance around how to adjust your monitoring and evaluation activities during COVID-19. And it has a lot of really great suggestions in it. And I wanted to just highlight a few of those for you that I have found have been extremely important in navigating this time. And one of them is, in the humanitarian and development world, we talk about the do no harm principle. Do no harm basically means that any activities that we're trying to do to the benefit of communities should not intentionally or unintentionally put anyone at risk or do any harm to anyone. And we have to think about that even more closely with data collection in the context of COVID-19. Simply by trying to collect data with people, we could put them at risk if we're not respecting the restrictions that have been in place. So that is our top principle in this guidance, that ultimately people's safety comes first. And so we have to use that principle in making decisions about data collection processes. We've found as well how important it is to be overly communicative with our donors and with other stakeholders, to let them know, look, things are changing all the time. And even though we have planned something out, it's not going to plan, and we're adapting our plans for data collection based on the reality. And that goes with the third point, that we have to be flexible. We have to be okay with delays in data collection and prioritize certain activities over others. But at the same time, we also have to be able to produce quality data. And that's one of the things I'd like to go into a little bit deeper with you all. When I was assigned a task to look at how confident are we in the quality of data we're producing, even under these restrictions that we have? So some of you may be familiar with this term, data quality assessments, but for those of you who aren't, a data quality assessment is a process to help staff and partners do a number of things. It's a structured approach to assessing a set of data and its quality using established quality standards. It helps the team to understand strengths and weaknesses of their data and the extent to which they can trust that data to make important management decisions. It's a process where we can document any limitations in data quality and thus influence our ability to use it for making decisions and establish a plan to address any of those limitations. And this definition comes from USAID. So this was the assignment that was presented to me. The donor had expressed concerns with the quality of the data that they were receiving from a multi-country project. And so they were imagining that really it was a very negative situation, perhaps. The data, they were just, this is an example of maybe what their nightmare of data quality was. They didn't have a lot of confidence in the data and they weren't sure that they could use it to make important decisions. So my company's internal leadership wanted someone to conduct an internal data quality assessment to identify areas of weakness and to develop an action plan to improve upon those areas. So I received this assignment and had to figure out how to do this work without traveling. So I had to figure out how I could answer all of these questions with a team that I wasn't going to be able to visit, I wasn't going to be able to observe them, and I wasn't going to be able to see any of the processes that were going on. So before I tell you a little bit what I learned from the process, let's take a step back and look at what are those standards of data quality that I would have to assess. There are 5 standards that USAID uses, these first 5 puzzle pieces here. So validity, reliability, timeliness, precision, and integrity. And I'll explain those in a little bit further detail. At Winrock, we also added 2 more that we often look for in these data quality reviews. We look at the confidentiality and the data protection. And we also look at how complete the data is. So we'll go through each one with a short definition here. So validity, or also known as accuracy, is looking to see if the data should be clear and adequately represent the intended results. So we look back at what was it intended to measure and how well is it actually measuring that. Reliability is that we're confident in the way that the information is collected through methods that are consistently used over time. Timeliness means that data has to be available at a useful frequency. It needs to be current and should be made available for management decisions at the appropriate time. We wouldn't want to be making management decisions today on information that's relatively outdated if we can provide a more updated data point. Precision. So data must have a sufficient level of detail to permit management decision making, so that we understand the level of data that we're providing is able to give enough of the information that they need so that the margin of error is less than the anticipated change. Integrity. So data collected must have safeguards to minimize the risk of transcription error or data manipulation. And then the 2 that we like to add as well are confidentiality. So there are many, many more rules and regulations in place today than ever before regarding confidentiality, but data must be maintained in accordance with national and international standards for data protection. And finally, completeness. Data represents the complete list of eligible persons or units, and it's not just a fraction of the list. The same is true when we're reviewing data sets or completed forms, that we want to see how complete and and finished are the things that are being submitted through the system. This is an example of a data quality assessment checklist that's produced by USAID. As you can see, this is something that implementing partners like my company or third-party evaluators may use to assess the quality of data in an ongoing monitoring and evaluation system. So each of the different criterion that I mentioned are included in a checklist like this with questions to help the investigator understand and judge different aspects of those criteria for the different indicators involved in a project. So I used something similar, a modified version of this checklist in order to conduct this data quality assessment with the team. One of the biggest challenges I found was that, and this may be also my personality as an evaluator or as an M&E professional, I really like doing things in person. When you're in person, I find you can be really creative in trying to find out information from people. So in person, you can use a lot of different ways to facilitate reflection. You can help people map processes out by using flip charts, by using Post-it notes, creating, roadmaps and everything. And I find that the discussions that you can have help the group come to a more detailed analysis of what's going on. And so that's really difficult to do or to create the rapport with a group. It's harder for that to translate to virtual. I personally found it very difficult to do the same types of things that I would have done in person virtually with the team. But I was surprised there were a few benefits that I found to doing it virtually that I would have never done in person, which was I could actually go into greater detail in screen sharing some of the documentation that the team shared, where we were able as a group to all look at our computers and screen share specific data sets or specific documents. And we got into a level of document review as a group that we would have never gotten to if we had conducted the process in person. And I'm learning more as well about the online applications that do permit more participatory exercises. There are more tools and apps out there than ever before that allow for people to do that together virtually. It is dependent on how comfortable people are with that. And then oftentimes it's also very dependent on how well your connection is able to be, with the connection with internet and things like that, of course. You also, for both situations, still, again, have to develop rapport with the individuals that you're talking to. It can be a very tricky process to try to ask questions about the quality of a team's data when they can feel that you're judging them, when they can feel that you're going to produce a report that they're going to get in trouble about. And so that ultimately can lead to them maybe being reluctant to share things. Virtually, if you're connecting virtually and the connection is not strong enough, people may not share their video. And then for me, that gets even harder to develop the rapport with someone. They don't see me as a person trying to do their job. They may just hear me as a voice coming from somewhere in the world who may be out to produce a report that could be negative in nature and could, create problems for them. So those were some of the things that I found to be difficult, but also interesting in the process of trying to conduct this. A few other things that I found in conducting this data quality assessment was that in this team, it was feasible because all of the data had already been digitized. The team was already using an ArcGIS platform, Survey 123, for all of their data collection. It was all already available in data sets that were already saved in a centralized location. And if that hadn't been the case, I don't think I could have conducted a review of it at all. It probably would have taken a long time just to get all of that information centralized. So, and then in doing some debriefs with my team, we came to the conclusion that, again, if it wasn't already clear before, it's very clear now. We can't have any exceptions to not having digital data. So we also found how important it was to have everything centralized. Archiving may seem to some teams like a very annoying thing to do, but it's probably one of the most important investments that they can make in ensuring that their information is used for decision making and for, you know, good use by different teams around the organization. This team simply used, you know, archiving within a Microsoft Teams, and they did an excellent job keeping everything together. So that was also really important for a virtual assessment of their data. It was very important for me to identify the staff who needed to be interviewed. And so it may seem obvious, okay, well, you need to talk to the data people. Who are the people collecting and who are the people making, you know, the decisions about how it gets collected? But quite interestingly, I've found in this process, it's not just the people who are in charge of it, but it's their supervisors you really need to talk to, because limitations or constraints that they may raise might ultimately come back to decisions that are made by leadership. So that was something I found to be really important, that I knew, or I could find out who needed to be interviewed in this process. In this case, I knew that there was always going to be a limitation. There were always going to be limitations present. So the most helpful way to go through the process was to focus on the flow of data from the point of origin in terms of how we developed the indicator definition and language, and try to follow the flow all the way through to the data that was ultimately collected, and see where there could be risk of breakdown in the quality of that data. And so I was able to interview multiple staff to get an idea of, did we have different understandings of definitions? Did we have risks of things being not translated correctly? And most of what I was able to produce as a report was identifying risks. So maybe not necessarily, this is definitely bad data, but I could point out definitively where there were risks to the data quality. And I think that was probably the best way to explain, look, this is a completely virtual DQA. I cannot tell you these things definitively because I can't be there, but I can tell you that this puts at risk the quality of your data when you do this or when you do that. And so to flip it around for a action plan, it became more about, these are things that you could do to reduce your risk of poor quality data and improve the likelihood that your data is of higher quality. And that seemed to be very well received by the staff, and they seemed to like that as well. So it was less punitive than perhaps sometimes reports like these tend to seem or to feel. So my final kind of overall lessons that I had here were that remote and virtual monitoring and evaluation activities are really, they were maybe already becoming more normal, and they're just more and more and more normal now. One example I will give you too is a project that I support just had their very first virtual monitoring visit from the donor, which meant that the donor representatives that were in the capital of the country called into like a Zoom call, and someone in the field had a tablet and they were showing them the village, and they were showing them the locations of the programming. And that's the first time I've heard of that being conducted completely virtually through like a Zoom call just like this. So I think we're just going to continue to see more and more of these examples where the donors are more comfortable with this, and we have to also just increase our ability to be more comfortable with these things too. So it's a good idea to invest time and resources into building different teams' comfort with these new ways of monitoring and of evaluating, and especially more than ever, being comfortable with virtual calls, virtual conferences, virtual ways of working in general. All right. So those are all the things I wanted to share with you. I know it's a lot of information. I'm happy to go back to any of this here, but I'd love to hear from you of experiences that maybe you've had or that you've seen, but I'm also happy to answer any questions that you might have.
Thanks very much, Ashley. Super helpful. I especially like that aspect of being able to say where you have risk to data quality. That's an important way to conceptualize it. I have a couple questions myself, but I think we have Nicholas who jumped in with hand up first. So I will go ahead and suggest that Nicholas ask his question.
Sure, I can go ahead and start. Thanks, Bev. That's fine either way. Hi, Ashley. We spoke a couple of months ago. Great to see you, hear from you again. I couldn't agree more with your overall conclusions, having kind of worked in the M&E space and international development for the past 3 years. I kind of entered the field in sort of a pivotal period where things were already very much digitized, right? So the vast majority of data collection that I have experience with has always been done using computer-assisted telephone interviews or even personal interviews where you have data collectors out in the field kind of inputting survey responses into tablets, which is then getting uploaded to servers and kind of QC'd or DQV'd from there. One thing I just wanted to add to your final point about kind of, in our field, how we have to be more open to the idea of these kind of remote approaches. I think hybrid approaches have been a huge lesson. Learned from kind of my organization over the past 2 years. When we're training a data collection team, so we generally partner with local organizations, local data collection firms, and kind of play an intermediary role sometimes, right, between those local firms and our clients. So what we'll do if we design a survey or design a methodology, whether it's for an evaluation or just a sampling approach, we'll have a pretty extensive training of trainers session for our field team managers, who will then go on to kind of lead an in-person training, right? So like the international travel restrictions, we can bypass through technology, through teleconference. But of course, our data collection team is kind of meeting in person. And then of course, we can call into that actual training event. So can our clients, usually USAID or whatever organization we're working for. So really just to totally agree with your conclusions here, I think this is becoming the industry standard as things progress.
I like that. I think a hybrid is the right term to use, right? Because it's easy to use categorical terms, but I think that is such a good example of the flexibility and adaptation that we're becoming, more accustomed to. Thanks for sharing those examples.
Catherine, I think you're next, and then Mitch, and then Nada.
Yeah, hi. Actually, those comments transition really well into the question that I had, which was kind of keeping in mind the idea that a hybrid methodology is probably going to be what we see in the field going forward. I'm curious, from your perspective, what elements of the current virtual formats you can see being more permanent, and what elements of the kind of pre-COVID approaches would you prioritize bringing back once it's safe to do so?
Yeah, such a good question. I would agree with Nicholas that really the data collection as directly into a mobile platform as possible is kind of, it was becoming and already had been considered industry standard, and now I think it has to be, it's like industry necessity now. Right. So like at Winrock, we are getting as many of our programs to paper free as possible. But even in that, in some locations, there's like a growing process, or there's a distrust, or there's a comfort level of we've had some places where we've equipped it to the extent possible, and people are still using paper and the digital together. And so that it's essential, but still growing. But I think we'll get there. I think that even just in the last 5 years, in so many of these locations, so many more people have their own personal comfort with smartphones and applications and things like that too, that leads to the digital literacy that enables that comfort to grow. So I think the gap there is going to close, and that's going to be something we're comfortable for, or comfortable with. I was super surprised to hear about this mission that did their whole monitoring visit digitally within the same country. Like I had a ton of questions when we did our check-in, how did that work? And were they satisfied? And, even it translated to the point where they went to a village, and the village leaders still did like a welcome ceremony like they would do in person, and they just had a tablet and they were like videoing it. I thought that was just fascinating to hear that that's something that the donor agreed to, the village leaders agreed to. There wasn't discomfort about using camera or video, like it was agreed. So I don't know to say like definitively that any of these things. I just think that technology is changing so fast. And it has changed so fast that I don't know, maybe this is going to look so different in like 3 years with the added pressure of restrictions and COVID being a reality. That's just me. I'd be curious what other people think too. It's such a good question, Catherine. Thanks.
Thank you.
Yeah, just a side note, I was noticing as you were going through this, a lot of these were techniques that are very common in conflict zones and in those types of environments. I was wondering about your experience of that.
Yep. It is. I think even some of the guidance we've gotten from USAID comes from their humanitarian side, or the remote monitoring guidance that they have had developed for a while comes from conflict affected zones specifically. And in locations where they've had that experience, some of that is translating into the new normal of not being able to physically visit as many places as was traditionally considered normal and common. Personally, like I've been working in West Africa for the last 10 years. We have a lot of conflict affected locations there. And so we've had to make adjustments for many of those zones. But I think you're absolutely right that most of this comes back to the flexibility needed in order to make those adjustments. And then generally what we try to do in those places is we just try to get as much information as we can to triangulate it, if it's possible, through multiple methods. So that if we are we're not relying on a single source of information or a single source of data. If there's any way we can connect it with other pieces of information. So say we may have to be more reliant on a government system for a particular data point, if we can complement that by collecting case study information, or we can interview some respondents or interview some key informants at the same time, to confirm how confident we are in information that we're getting, then we can do some of those things. But actually, some of the guidance we've gotten from USAID has been developed from the conflict affected experiences.
Do you see yourself going back to your pre-pandemic, fly around the world approach at all, or do you see an advantage to that, or do you see any pros and cons to going this direction, and do you see yourself going back to traveling 25%?
So really good. I don't think it'll be 25% in the future. Honestly, I think this is also kind of in some of the larger international organizations I've been in, they've known for a long time that this model has been too expensive to have so much travel from, especially US based or like home office based travel. And it goes against, I think some of the, emerging research and knowledge about localization, decentralization. It is also not very green, quite frankly. So a lot of organizations that are looking to try to reduce their impact are taking a really big look at how often they're flying people around the world and what impact that has environmentally speaking. So there's a lot of different reasons why I think it's going to reduce. And I think it's going to be more locally focused. So perhaps maybe more regionally focused, and more people like me and the jobs that I have may be more distributed more efficiently around the world versus based over here in Virginia. That's the way I see it going. I've seen that happen at Save the Children actually in the last 5 years. They've been trying to redistribute that type of technical assistance.
So it'd be more regional approach instead of sitting back here in the US and looking out.
That's right.
That's actually better, I think, because you get more in-depth region. I presume that. But
absolutely, I agree.
Thank you.
Yeah. Great. I think Nada.
It's pronounced Netta, but it's spelled wrong. Don't blame my parents for that one. But thanks so much for a great presentation, Ashley. I'm currently working with a local education nonprofit that's working on assessing its virtual programming and curriculum, and it's come across their mind and they're concerned about the validity of their data because they're receiving it virtually. They especially pointed out questions regarding students' socioeconomic background, wondering if students will be uncomfortable answering that question virtually as opposed to in person. Frankly speaking, I didn't think it mattered whether they're in person or virtual answering that question. It sounded like their interest was more, is the question even appropriate to ask if, for example, students receive free and reduced lunch to assess their socio-emotional background. But I'd really love your take on it.
When you say that they want to assess that virtually, does that mean instead of sitting down with somebody and asking them those questions, it's through a video call or something?
Yeah, they're doing virtual focus groups as well as disseminating surveys through SurveyMonkey and so on and so forth.
Interesting. Personally, I think a focus group virtually is super weird. That's my personal approach after taking Dr. Peters' class about
Agreed.
So no, and I love facilitating focus groups. I think it's really interesting, and I definitely think it's a particular skill set to facilitate and to get the kind of, for lack of a better term, the vibe in the room. But there are certain things that you can appropriately get from focus groups and then other things that you shouldn't be getting. When you have a group of, depending on who is in that group and what kind of, how that translates virtually is there are some similarities, but the thing that you don't know is how comfortable are each of those people with the virtual setting that we've created now. That's the part that there's no way for you as a facilitator to know when I'm looking at all of your images, which ones on here are fully comfortable with this platform and which ones are completely terrified. And that puts certain people at different advantages or different disadvantages as this becomes a space for common discussion. So maybe in a couple of years, I'll just have to get used to it and figure out how to adapt those skills for a virtual setting. But the question in and of itself does seem like it could be one of those that's sensitive in nature and wouldn't be appropriate for a focus group discussion. Maybe but then you also have the when you're sending out surveys without a person, maybe contacting someone and filling out, digitally with them, then you have the respondent rate issue. How comfortable and interested are people in responding to that?
Right. Quick follow-up with that. And I agree with you. It's really hard to use these things. It took me 5 minutes to figure out how to raise my hand on here. But so I can only imagine students are suffering as well. With that in mind, though, you mentioned response rate, and they had a concern about access, given that they're working with let's just say Black and brown students in DC, right, who come from underserved backgrounds, who may or may not have computers? How do you capture that in your overall reporting to caveat that this is the data, this is the sample size, that it's within the context of limited access to internet?
Yeah.
So can I just add, and that was going to be one of my questions as well, is you had talked about doing interviews over the phone, and how do you ensure the equity of your respondents given technology access? So it's, you know, this is all over the world, and it's a real challenge for data equity.
Absolutely. I think some school districts, I only am familiar with a few in Virginia, had to do further study into access, both with internet accessibility in counties that they were serving, as well as equipping with, you know, the actual computers. And so I know in Virginia, they had to make available Chromebooks for every student in the whole state, I believe. So perhaps there's information from their related educational system. I think during the pandemic, or at the beginning of the pandemic, more studies had to be done in this case in order to provide for those needs. So both looking at what is the current accessibility rate or access to internet. I think that's something that counties have had to look into. So maybe that data is available. And then the actual, you know, hardware and stuff. In the work that we do, the similarity would be that we don't generally send out like a survey, like through email or even text messages. I think there's only one project that I know of where we actually formally partner with a cell phone company in Senegal. And so because of that partnership, they have been doing some surveys through mobile technology with like a touch response, but that's the only example that I'm currently aware of. Otherwise, we have teams that are equipped with tablets where they're still going physically to people and they're recording the responses, because response rates on sent surveys tends to be very, very low, generally speaking, but that could also change, you know, in the future if it's well targeted. But if we don't know if people even have access to an email account or to however we'd be sending it, then it would be very, very limited, depending on their distribution method. But market research, so the side of market research in the US and elsewhere it's like a different subspecialty, but they have a lot more experience distributing and sharing information in this way. I only know about it a little bit because I've worked with child sponsorship models in some of the organizations I've worked at, which have a very close tie to marketing. So we're often looking at marketing research where they're trying to do research with people who are interested in funding these programs. And they seem to have a lot more experience with, you know, what are like good response rates and distribution methods and things like that. But that's a different specialty I don't really know as much about. I think so. It looks like Nicholas, is that an old hand or a new hand?
That was a new hand, but if somebody had a directly relevant question, because I was going to take it in a slightly different direction. So Catherine, I'm not sure if you want to follow up, you're more than welcome to.
Yeah, my question is kind of along those lines, and you touched on this a little bit just now, but you know, the things that we're talking about in terms of equity and access to technology and stuff, you know, strike me as, you know, before you would kind of decide on what virtual methodology you'd want to have a sense of in the place where you're working, what kind of access there is to technology, and they're having like a technological access assessment or like a digital literacy assessment. Or just some kind of a, you know, a pre-data collection way to understand what methods would be, you know, appropriate in this community, or what populations might be left out with particular methods. And so I'm curious if you or any of the organizations that you're working with have particular strategies or methods for doing those kind of digital assessments for determining your methodology?
So for me, no, because most of the digital application we're using is not reliant on the respondents' access to technology yet. It's still equipping our teams to have the digital access. So it's like everything else is the same, basically. In that our field officers or enumerators are still the ones going out. We're still planning the way we mobilize people or how we're going to respondents is still the same. The only difference is that instead of a piece of paper, they're using a tablet. Now, if that changes, and when that does change, because I'm sure it will, that would be really important if we're trying to start making we have tried doing a few surveys over the phone, like I mentioned, but not having done a survey like what you're talking about or doing some type of pre-assessment. It was really, I think we did it in a few cases where we had to get some kind of information. We didn't know how long these restrictions were going to be in place, and it was a stopgap, basically. So it probably wasn't done in the most ideal way, including really getting a good look at who are we going to be able to talk to, and more importantly, who do we know we probably won't get in touch with because they don't have access. It's a really good point. I don't know if others have experience with those types of assessments, but that's really useful.
Thank you.
Nicholas, did you want to take us in a different direction?
Sure. Hopefully it's not too broad of a question. And if it is, maybe I can try and reframe it. But I am super curious to know, Ashley, from your perspective, like, what does bad data look like? Like, do you have particular issues that you screen for? Do you have flags? Is it automized? Oh gosh, my vocabulary is lacking. But what is bad data look like? Yeah.
That is really broad.
I mean, like it can range from anything from like audio fraud. Like oftentimes, you'll capture audio recordings of survey questions being asked. You can very clearly hear, even if you don't speak that language, right? Like, is the question actually being asked? If not, it should probably be deleted during some kind of quality control process. So I don't know if there's like big things that you all look for, or if it's kind of project or methodology specific.
Yeah, well, I think looking at, you can kind of go down the route of what I'm usually presented with is, here's a set of data we're about to submit to a donor for a report, right? And so when I go in and dig into it, I want to see, I might want to try to find the data trail of a particular data point. Like, so you said this is the number of people that we did such and such with. Where does the source come from? And where does that come from? And where does that come from? And when we find holes in that story, then that data, it might have looked like good data because it's filled out and the report is complete and ready to go to the donor, but it's actually bad data because it's not standing on solid, foundation. That's not maybe the best. So that's kind of where I see my job is, unfortunately, being in a position where maybe a program officer is like, yay, our data report is ready to go because it's got numbers in it and it's finished. And I have the unfortunate job of saying it might look pretty, but it's bad because of X, Y, and Z. And so that's where we're trying to do in Agile, our unit, and we're investing in a lot of efforts to try to reduce these risks and improve the likelihood of good quality data from the start. I'd make the distinction that there is probably no such thing as perfect data in international development. That would be my personal perspective. Because we're always trying to balance if we tried to get perfect data in international development, it would cost a lot of money, a lot more money than we have, or it may take way more time than we're able to do. So that's where I think good data is somewhere in between it being bad and perfect.
I think it's a great answer. Yeah, totally answered the.
I can do.
No, totally answered the question. Totally answered the question. I appreciate the kind of transparency. You know, nothing is perfect in our field, or in any field. But I guess that's why we have our limitation sections in all good reports.
Yeah, and I think too, what we try to help teams think about is okay, you have your numbers, or you have your percentages, or you have your qualitative information, but come back to the indicator that this result is supposed to be. You know, the indicator that's supposed to be tied to what result? What are you trying to learn? What do you need to know? And this might tell you one part of that result, but it won't tell you everything about how you're doing toward that result. What are other things you can find out that will help that story and help you understand the story about that, the getting to that result too? I think we try to help teams understand that, you know, there's a lot that you can try to understand about progress toward results too.
Thank you.
I have one more question before we wrap it up. You had your pieces of the data quality puzzle. Oh, you can see my dog.
Yeah.
That's so funny. I don't know if you caught that. Okay, there you go.
Yeah.
Slipping behind me, funny. Anyway, you talked about the pieces of the data quality puzzle. And as I was looking at that graphic, I was thinking, you know, would equity be part of that puzzle as well? Or would equity be under completeness? And I was thinking to myself, you know, I could see a scenario where equity would be a good part of that puzzle.
Yeah.
But then it's kind of defined under completeness as well.
I think it is, but I think it could be more explicitly there as well. Yeah. So we are also, because our unit has a very strong connection between data and gender equality and social inclusion, one of the things that we're working on is how do our MEL plans explicitly look at gender equality and social inclusion. And so often there's a gender equality social inclusion analysis that has to be done at the start of USAID projects. And we're trying to build in the data related recommendations from that into our MEL plans, which may get at some criteria that could help us check how well are we ensuring that we're covering and getting data on all different groups of individuals who should be connected to the project in some way. But that yeah, I think it could fit in here, completeness.
Yeah, because at first when I was looking at your graphic, I was like, oh, shouldn't there be an equity one? And then as I was reading this, I thought, oh, I think the equity is in the completeness part of it. But interesting. Yeah. Well, I want to thank you very much for leading our workshop today. We appreciate the time that you spent with us and for helping us better understand how we can assess data quality. I want to thank all the students and faculty that came as well. I know some people had to pop off early, but it was a really helpful session. Next month, we have 2 events, so watch your email for those. On April 1st, there's a student-led conference, which Catherine is actually involved with, on adapting evaluation to change. Are we ready to tell people who the keynote speaker is, Catherine?
Yes, I believe it's on the website already.
Okay, so Kylie Hutchinson is the keynote speaker for that event. And the other is a panel discussion on resisting carcerologic, statecraft, and othering in evaluation with Ezra Santon Perez Bill, Dr. April Patillo, and MSME alum Michael Patillo. And that one is on April 4th. So I will probably send out an invitation later on today. Thanks again for joining us. I really appreciate it. Learned a lot, and it was great, as always, to meet with everyone and chat.
Absolutely. Thank you all.
Thank you very much. Take care.
Thanks. Bye.